Board of Health. We'd like to call the meeting to order. We're going to do a roll call to establish that we have a quorum tonight. So we'll start out with Dr. Hayes.
Here.
Scott McIntosh, Dr. McIntosh. Dina Dixon.
It's the same guy.
Kelly Pack Smith. Kelly, we see you. Can you? Okay, we'll come back to Kelly. Natish Patadar. All right, Rick Fleming. Natish, it looks like you might be signing on.
Yeah.
Rex, we know you're there. There we go. Commissioner Cole. There we go. Commissioner Cole.
Here.
Martha Engelke.
I'm here.
All right. Adam Harrell.
Here.
Lowell Spate. Hello, Lowell. All right. I think that's it. Now circle back to Kelly.
I'm here.
All right, good. Okay, I think do we have everybody down there, Betsy? All right. First of all, are there any public comments? First of all, I want to thank the board for being so engaged, and we've got, there's Lowell, pretty much everybody on tonight. Are there any public comments tonight? Okay, hearing none, we'll move on to the minutes of the previous meeting, the March 10th meeting. Were there any corrections or additions to those minutes that were circulated previously? Hearing none, is there a motion for approval?
Move to approve.
Is there a second?
Second.
All right, any further discussion? All in favor say aye.
Aye.
Any opposed? All right, the minutes are approved. Move on to fiscal report. Marcia?
I am discussing the fiscal report for period 9 for fiscal year 1920. This period ended on March the 31st, 2020. We did have one budget amendment for the Minorities Diabetes Prevention Program that got added and approved by the Board of Commissioners in March. That amount was $29,432, which brings our overall approved budget to $11,864,223. The month of March overall was a very good month. We're down just a little bit with our per member per month. That would be our Medicaid programs of pregnancy care management and child care coordination program. Clinic fees are just only slightly down by $364. Our other category, most of that is due to timely invoicing. Overall, with our encumbered, our timing items, we have a surplus of $378,177. Are there any questions?
Marcia,
Yes.
Dr. Hayes here. How do you anticipate that the shutdown will affect our revenues?
Well, we are still seeing some services, our mandated services, we are still billing. I'm slightly a little bit nervous because we were on track, very good track, but the month of March was good. April, I am nervous, but we do have some income coming in, and Dr. Silvernail and I met with Scott Elliott and the budget finance for our budget for next year. That is also going to be discussed at a later date. We really, truthfully, at this moment, I'm interested to see how April's going to shake out. We're still doing restaurant inspections. So some of our mandated services are still going on. We're trying to do some telehealth. NC Tracks have opened up a lot of rules so that we can start billing. We've added the telehealth billing codes. They were already in Epic. So hopefully we'll get that going. Dr. Hardy and her staff's been working really hard at that. So hopefully it will be another source of income indefinitely with telehealth that we're looking forward to. But I'm gonna stay positive for right now about it.
Okay, any other questions? Is there a motion to approve the budget as presented?
So move.
All right. Is there a second? Any further discussion? All in favor, say aye.
Aye.
Any opposed? All right, great. Okay, Marcia, what else you got for us?
Well, we've got 16 vacant positions, and that is actually no change from last month. The county has somewhat frozen positions at this moment. The way the economy is looking, we have not been able to advertise some of the vacancies. Just wanted to report on that. And we also received notification from the state yesterday. Today is Monday. No, today's Tuesday. Yesterday, that we were receiving $133,000 from the state for the COVID-19 response. That is on the Board of County Commissioners agenda for April the 20th. And that is for local health departments. Every health department in the state receives some funds to help with some of the response and the laboratory and all the different costs that we have got, we have incurred. And that actually goes back to January the 20th.
Do you think you've incurred costs that high, or I guess it doesn't really matter?
I think it's adding up. I think, we've got the well, in the beginning, in the breezeway, we have our staff taking temperatures, and that's staff that would normally be out on postpartum home visits. So we do have staff that are working and they're coding their time to the COVID. So I do think that we will spend some of that. And we also have some costs with replenishing some of our gloves and masks that we're ordering, maybe some testing supplies. Also, what is really good about this is that the state fiscal year ends the end of May, but we will be able, whatever funds are not spent, will be able to roll after May, which
Okay.
is usually not the case for state funding. So that's a plus for these funds.
All right, very good. Any additional report?
That's it.
All right, thank you very much. We appreciate it.
Thank you.
So we have no items for old business, so we'll move on to new business. Are there any items?
Hey, Dr. Ramsey,
Oh,
it's
yes.
Tom Colson.
Yes.
I just want to say that if I had not known or heard that Scott had frozen any positions, and I'm not happy with this, he's going to be getting a phone call from me right after this meeting, because this is the wrong thing to do at this time as far as I'm concerned.
Yes, sir. We've had a lot of discussions about that, haven't we, over time?
Yes,
All right,
we
very
have.
good. Well, if there's no other new business, we'll move on to Health Director's report. Dr. Silvernail?
All right, thank you, Dr. Ramsey. I thought the board would want to know mostly about the health department's activities through this response so far. So bear with me for this being somewhat of a long report. I also sent you a hard copy report that I shared with the county manager for our county commissioners this afternoon, and I will be addressing them next Monday at their scheduled meeting to answer questions for the Board of Commissioners. From a general perspective, we have been all COVID all the time. And I want to remind the board that most diseases, we've had decades, if not centuries, of experience with and time to study. With COVID, we've had about 4 months right now. So there are still many unknowns with this disease. While the COVID-19 response is taking more and more of our time, we continue to work on core public health programs such as maternal child health, general communicable disease, food insecurity, and others. We appointed Amy Haddam as deputy director, or promoted Amy Haddam to deputy director. Amy's been an integral part of this response. She's currently overseeing our Pitt County Health Department hotlines. She's managing the Pitt County website and working with our county PIO on the county coronavirus page, providing him public health information to go to that page, which includes many things, not just public health information regarding COVID. She's been assisting me with the preparation of media messages, both written and verbal. She's authored or co-authored multiple press releases for the COVID-19 response. She's responding to emails from the general public and helping me answer some emails which I've received directly as well, and continues to see the non-COVID work of the Health Education Division. Moving on, Marcia already hit our human resources issues. At this time, there has been no changes, and my understanding is that the positions are frozen for right now, pending county finances. Communicable disease, again, I want to remind you, there are other communicable diseases of public health concern out there. We've had a pertussis case that we had to work and follow up on exposures with. We also have an active TB case that we're monitoring and providing directly observed therapy to. So our nurse is actually going out to that individual's residence to administer his or her tuberculosis medication on a couple of times a week basis, I believe, with the regime that he's on. As far as COVID-19 related activities, myself, I'm meeting with our management team, the Pitt County Health Department management team 3 times a week. We had done daily for a while, but we felt that we really didn't need to be daily. So right now we're on a Monday, Wednesday, Friday schedule with the management team to make sure everybody's aware of what their partners are doing in the response. I serve as the liaison to local providers and local healthcare systems. So I take phone calls, emails directly from some of those providers. I've also been serving as a liaison to government officials at all levels. Amazed at how interested some of our government officials have been, and how often some of them are checking in with me. Twice weekly, hopefully you've seen some of our media sessions with our response partners conducted from this room at 11:30 on Tuesday and Thursdays. We felt it was better given the number of requests that we were receiving for interviews with myself and other staff to just have a standing press conference a couple of times a week and try to give the media the answers that they need. We have allowed some of our staff to do individual interviews with the media on subject matter areas. So we did one this morning on WIC issues. Jim Gardner did our mosquito issues. Mark Phelps did something on cleaning products and restaurants. We tried to offer those things up to the media to help them with their stories and get information out there. Battling the information issues in this is probably as hard as battling the viruses itself. Myself and Amy are participating in the multi-agency coordination call that happens on Wednesdays with Pitt County partners. I've been working with other county agencies to answer their COVID-19 related questions, including return to work questions for employees who have had COVID or have been suspected of having COVID-19. Meeting with local businesses and their employees to decrease fear regarding COVID-19 in the workplace. This includes Pitt County employees and even our own Pitt County Health Department employees who had significant fears and anxiety about their potential exposure to COVID-19. And we've tried to alleviate those fears and to protect them and offer them as safe of a working environment as we can. And you all know in general, we don't see sick people, but there's no guarantee that a sick individual might not walk into the health department. We have implemented screening at the front door to try and prevent that. But it's still possible that we might have a COVID positive individual come into the health department. At the request of our county EMS coordinator, I'm participating in a weekly EMS call where we talk with all of the contracted EMS agencies in the county. That's led by Jim MacArthur, the county EMS director. Myself and Dr. Portello, the Pitt County EMS medical director, participate, as well as Randy Gentry, the emergency manager. I review cases with our communicable disease staff multiple times per day. And on Monday, I began calculating a recovered number to provide to media partners and our political leadership to give folks an estimate of what we think, how many people we think are recovered from this infection. Our communicable disease staff review and interview all laboratory confirmed cases. Contact tracing is done as needed and appropriate based on the situation. In most cases, the individual has been in isolation and contact tracing is minimal. So I've got to say that the plans for folks when a physician chooses to test a patient for COVID, in most cases, that individual has been placed in isolation and has remained in isolation and the contacts have been very minimal. One of the things that hampers contact tracing is the turnaround time on labs, which we're still seeing anywhere from 2 or 3 days to as much as 10 days with some of the laboratories. And at 10 days, the value of contact tracing really becomes suspect because most individuals would have become sick from that exposure, or they're not going to become sick from that exposure. Their risk of becoming sick at that point is very, very low if they haven't become sick already. Our CD staff complete the North Carolina North Carolina electronic disease surveillance system report. That's an electronic system the state has for communicable disease reporting. Some labs push directly to that. Some other labs come to us and we push them into that. Talk more about that in a minute. My CD supervisor is prepares a report of testing and cases twice daily, which she shares with me and also shares through a data sharing agreement with Vidant. We're also sharing some information with our 911 center so that that information is in the system for positive cases, addresses only, no names in the 911 system. And it's flagged to be removed in 20 days from the 911 dispatch system. And then we have done some testing at Pitt County Health Department, and our CD staff does those collections as well on a limited basis, and usually in special circumstances where an individual could not be tested in other places. COVID-19 data seems to be a big bugaboo, no pun intended. For starters, public health data is tracked and reported by county of residence. And so there's some pushback or some give and take on that, because many times when a person receives their care in Greenville or in Pitt County, their data is sent to us even if they're not a Pitt County resident. So we have to sometimes look at that, review that, and then reassign that to the county of residence for that individual. We've also had a couple of cases. In fact, we had 2 cases in the same week, a week or 2 ago, and forgive me because time is just a blur the last 3 or 4 weeks here, where individuals had more than one address. They had a Pitt County address and they had an address in another county, and our CD staff had to evaluate that and determine which county was actually their county of residence before we would accept that case as a Pitt County case, again, to follow that rule of being tracked by county of residence. At this time, we have no guidance from the state in terms of reporting presumed or suspected cases, those cases that have not been tested. We are reporting only laboratory confirmed, and that's by real-time PCR testing, real-time polymerase chain testing cases at this time. We do not report or track presumed or suspected cases, those cases who have not been tested at this time. There also is now an antibody test available. The state has not issued guidance on what to do with folks who test positive on the antibody test. A positive antibody test would suggest past infection, and there's no guidance from the state as to how to report those at this time. Data flow is multi-directional, as I stated earlier. Some of the labs, the larger commercial labs, those report directly into the NCED system, and we see them in there. Sometimes those do need to be reassigned in that system. Some labs are reported directly to Pitt County Health Department communicable disease staff, and then these are entered manually into NCEDS, NCEDIS by our Pitt County communicable disease staff. As I said, staff must validate reported cases as belonging to Pitt County because of sometimes multiple addresses or because they were sent to us assuming the individual lives in Pitt County. And then we do redirect those to the county of residence where necessary. Death reporting, at this time, the state numbers and the numbers that we are reporting are laboratory confirmed cases of death. That's where there's been a laboratory confirmed case of COVID without clinical resolution or recovery from that case of COVID and a death and no other obvious cause of death to explain that loss of life. At this time, we have 1 laboratory confirmed case of death, COVID-related death in Pitt County. It is expected at some point that we will have death certificate or vital records data, which will be included into the death count. Again, the state is still working on how to manage that data flow from a vital records perspective, because many of those cases will not have a test result to go with them. It will be based on a clinician's suspicion. So currently the death count are only laboratory confirmed COVID cases. Our clinical services, we have at the health department, we have deferred well child care secondary to COVID-19. We felt that if a child was infected with it, while it's low risk to the child, they don't do a good job of controlling their respiratory etiquette. And we felt that at the time that recommended an excessive risk for our employees. So we have deferred those for right now, at least 30 days. Probably we'll end up with a 60-day deferral on well child visits. Our family planning and pregnancy care provided with some modifications to the process to limit face-to-face time. We're doing some of the interviewing over the phone or telehealth platform, and only bringing that person into the clinic for the time that the clinician needs hands on that person. Our dental unit has been returned back to the health department at this time until school reopens. The dental unit will see emergent problems. And they are working on some things of their own right now, some training issues and things like that. So that they're trying to be productive in their downtime. WIC and nutrition, the process for WIC has been heavily modified to allow for most, if not all, services to be delivered virtually or by telephone or telehealth. We still are seeing some clients in person on an as-needed basis, but we've really tried to keep that out of the office and the building if at all possible. WIC has also liberalized the types of food that are available under the program because the preferred brands are sometimes not in stock in the market. They've increased the availability of other food products under their benefits so that people can get milk and formula and things like that if the preferred brand is out. Health education is working on a stop smoking, stop vaping TV spot, which ties the increased risk of a worse COVID-19 outcome to smoking and vaping. I think some of that came down from the state as sort of a template, and we're working with that to get that TV spot out there. Budget workshops have been moved to the first week of June. We don't expect right now that that's going to be moved out any further, but I will keep you advised of that. Marcia and I did participate in the preliminary budget conference with the county manager and his team earlier this month. Environmental health is pretty much operating normally at this time. On-site wastewater is still doing their permitting process. Food and lodging inspections are still going on, even though the restaurants are closed to sit-down dining. We have done some modifications for our staff so that they can wear masks and that sort of thing while they're doing inspections. And if they arrive at a restaurant and find a sick person and feel they should abort the inspection, we are allowing them to do so. I will mention too, and congratulations to Mark. Mark Phelps has announced his retirement effective April 30th of this year. So Mark will be done the end of this month. I sent out earlier a note to you through Betsy of a report that's going to the county commissioners. Did you want me to go through that, Dr. Ramsey, or do you want me to let the board members read that themselves?
Certainly, if you want to hit the high points, I think.
Yeah, we I've had had a number of questions from commissioners about where can people get testing, who's providing services. So the first section of this talks about where testing and COVID-19 care is available. It was my feeling from the beginning that COVID-19 testing and care needed to be spread across the medical system to help alleviate the burden on any one provider. Last week, ECU physicians opened their telehealth platform to anyone who wanted to use it, whether they were an established patient or not. They are providing a drive-up testing service for those folks that they feel need to be tested. Physicians East has a drive-up testing service. Again, you have to be an established patient with Physicians East, but they are providing COVID-19 care and drive-up testing. We have pushed out test kits to a number of providers in the community. We are testing individuals on a case-by-case basis where no other method or no other testing is available. And we do that as a drive-up in our parking lot. We'll test county employees where needed. Right now, we have about 55 test kits in stock. One of the limitations for us in terms of testing is we have limited supplies of personal protective equipment, which would limit our ability to do the test collection. Vidant has testing basically at the medical center, in the ED, the children's ED, and for inpatients. They do the rapid platform for anybody that's going to be admitted and high-risk ambulatory groups. and they have said that they're willing to test critical staff, first responders, healthcare workers, potentially others with their rapid testing platform pending their availability. And my understanding is that that availability has improved dramatically in the past week or so here with their capacity to do the rapid test. Vita Medical Group, and particularly Vita Family Medicine in Greenville, is doing telehealth for established patients and has a drive-up testing site for those established patients. Vita Occupational Health is doing testing for Vita employees, also doing some testing for ECU or Brody School of Medicine employees, and their testing is also done as drive-up. There are several urgent care facilities and other private practices in the community offering the COVID-19 testing and care. State Laboratory of Public Health has, first let me mention that state and national guidance do recommend that only symptomatic patients still be tested at this time. And any physician or advanced practice provider can order a test from a commercial lab. And there are several commercial labs that are providing COVID-19 testing at this time. State Laboratory of Public Health has dropped the pre-approval requirement, but they do request that a patient be symptomatic and fall into one of 4 specified categories. Those samples either need to be overnight shipped to the state lab or sent by private courier to the State Lab of Public Health. A private lab here in Greenville is offering the antibody testing. We had some questions about that at the press conference this morning. There's information there for you about that. We have been asked to participate in a prevalence study with ECU School of Medicine, UNC Chapel Hill, and the State Health Department or DHHS. We're still working on that, but in all likelihood, we will participate in that study. COVID-19 surveillance, that section pretty much covered that with you. Rapid testing, I have not spoken to, but had an email conversation with the Abbott rep regarding the 5-minute test that many of you have heard about. It's 5 minutes to a positive test. It's 15 minutes to a full negative test. 12 to 15 minutes to a full negative test on that platform. I've looked at that platform in the past. It's a great platform. Very impressed with it for its flu and strep capabilities, RSV capabilities. Would imagine their COVID-19 testing is as good as those things. I do have some information about that platform that I can share with you. Abbott right now, at the discretion of the federal government, is sending those devices only, or those instruments only, to high prevalence areas. So New York, Michigan, probably Louisiana, places like that. So our ability to obtain one of those things is not possible at this time. Sometimes there's been a suggestion, well, we should just go out and test everybody in the community. If you were to look at this rapid testing platform, which I think is a good platform, the instrument itself costs about $5,000. We would need more than one of those. The test kits would run probably something on the order of $45 per test. So if we did 5% of our Pitt County population randomly, roughly 10,000 folks, we would look at about $450,000 just in test kits or test reagents to complete that project, which is not something we have budgeted for at this time. There are also a number of other rapid tests that have come on the market. Some of those tests do not have the ability, excuse me, to discriminate between normal human coronaviruses and the COVID-19. That's a big issue with those kits. Some of those have a poor sensitivity or specificity. Again, their performance characteristics are not optimal for the sort of work that we would want that testing kit to do. So I would caution you in not buying some of that marketing out there about these rapid tests, because not all of them would have the performance characteristics that we would want in a test to use in our community. The other thing that I've directed our management team members to do is to think about items for an after action report. One of the early realizations for me is that many of our response issues this go round could be improved or resolved if we had a primary care division at a separate location away from the main health department. Again, really don't want those sick people mixing with our well folks and the well care that we provide at the health department. So that might be something to consider down the road. Prior to COVID-19, we had talked about a data and analytics branch at the health department, probably housed within our health education division. And I think COVID-19 has shown us the needs to be able to handle and manipulate data and present that to the community, to political leadership in a way that's useful and timely. You can look at our AAR, or after action report issues, as local, regional, state, or national in scope. Timing can be considered a short, medium, or long term in terms of correction. And there would certainly be more discussion on this as we move through this response. But we have a kind of a running list of these things, myself and my management team. Happy to take any questions from you all as board members.
Well, thank you for a comprehensive report. Does anybody have any questions? We can't bite you through the microphone.
Can't bite me?
We can't bite anybody ask a question. So. It certainly dominated all of our lives recently. I'm sure everybody on the board feels the same way, and we really appreciate y'all taking time to be on the call tonight.
I'll say Dr. Ramsey and I have spent many a late night on the phone together in the past few weeks.
And we work very closely with Dr. Paul Berry, Prospective Health on the ECU side. So we're constantly discussing same issues. The good thing is we're all on the same page. Our philosophies and approach are very similar. So.
And we're lucky we have
This is Kelly. I do have a quick question.
Oh. Really? Okay.
So I'm interested in your sense of what we can expect in the coming weeks. What is your thought about the models that we perhaps have seen or heard about? What are your thoughts about the ongoing impact of the virus on our county?
Well, Kelly, I think we've had some success in blunting and spreading the curve out. If you look at the state data, it looks like the state curve is starting to plateau. Some of the ECU models had kind of shown some favorable trends as well. I think one of the telling surveillance curves out there is the influenza ILI curve, and it showed our normal peak for the year. Was starting to build the spring wave that we've seen the last several years in that surveillance. And then the last two reporting periods, it's gone almost straight down. And so the interventions that we've taken for COVID would also, stop the spread of flu. So some of that ILI may represent COVID, may represent the spring wave of flu, but I think there's some comfort in the rapid fall in that ILI rate, that the actions we've taken are having an impact, and lessening the height of the curve and broadening it so that we don't exceed the capacity of our healthcare system to deliver healthcare to those who need it.
I have a question. It might be addressed to Dr. Ramsey as well. I ran into Brian Floyd, and he said that Vidant was going to be producing their own reagents so that they could test more people, and that this was about 2 weeks ago. He said that he felt like it would take them 2 weeks to get to the point that they could do more testing. I don't know, Dr. Ramsey, if you know the answer or not, but how close are we perhaps to having a test that's more local that can be run that would allow us to do more testing?
Well, that's a good question. I hope everybody can hear Dr. Hayes. Okay. The question is, are there going to be locally produced or locally available testing for COVID-19 that's rapid? Dr. Fallon, the relatively new now chief of pathology, and his crew have done a remarkable job of getting testing in here. They have 3 different companies' platforms. They started with one and they added a second one about a month ago. And then just in the last week added a third one. And so we went from sometimes having only 10 or 12 tests left to test some folks before surgery or similar situations to having now multiple 100 tests available. So testing has now been extended to the hospitals within the Vidant network, the community hospitals. Not all of them have their own tests, but a number of them do, and we're waiting on the rest of them to come on board. So testing is the best it's ever been for us. We can basically get same day test available, sometimes just a couple hours later, depending on when the test reaches the lab. So we're in the best shape that we've been. We're not using the outside labs at all now, the commercial labs. So I'm not sure what Brian was talking about in terms of local production, but we do have 3 tests on board. And I think a 4th test is actually going to be added before long. So it's really helping us to test a broader, not just the patients in the hospital itself, but also some outpatients as well, which we really weren't offering before. So best shape we've been so far. Does anybody have any other questions? I'll certainly echo Dr. Silvernail's optimism. If you go to the North Carolina Department of Health website, at the very top is a box called COVID-19, and you can click on it so you don't have to search anywhere. And it's updated every day. They have the number of positive tests, the number of percent or number hospitalized. They have a whole lot of information there, more than I'll go over tonight. But that's one of the places that I'm sure Dr. Silver and I look daily. The NNO publishes a lot of that in a different graphic every day online and in their, I think mostly online. So it allows us to keep up with it. But as Dr. Silver mentioned, we're averaging between 250 and 300 positive tests a week. A day for the whole state. And we're anxious to see those numbers start to decline.
Yes, sir.
Any closing comments, Dr. Silvernail, or?
No, appreciate your support. Appreciate the engagement tonight. And if you have questions, please let me know.
Okay, if there's no other business, is there a motion to adjourn?
So move.
Is there a second?
Second.
Any further discussion? All in favor, say aye.
Aye.
Any opposed? All right, thank you. The meeting is adjourned. Appreciate your
Thank
involvement.
you.
Thank you.